Hi, this is Plus One Baby channel, and today I'm going to talk about scary things that happen in pregnancy. If you like content like this, then please hit the like button below, subscribe to the channel, and let me know about any scary things that have happened in your pregnancy, because I'm pretty sure that someone will have gone through it. So there's quite a few things that women get scared about during pregnancy. So in the early stages, when you start to feel the stretching and it can be quite painful, you really get scared that, is something happening to the baby? And in the beginning, I was a little bit frightened of things like this. So I read up a lot online, and after a few weeks, I realised that all of that was pretty normal. Other scary things are around big swollen hands and feet, and that can always be a worry. And most recently, towards the end of my pregnancy, one of the scary symptoms that I've encountered is severe itchiness. The itchiness is driving me crazy. And whenever you go onto Google and you look up your symptoms, they normally say there isn't anything to worry about. But if you are worried, then contact your healthcare provider. So I started to get a really, really itchy belly, and that is pretty common, especially as your stretch marks continue to grow and your bump gets really big. And I thought, no problem, that's what my itching on my belly is. But then what started to happen is I started to get really, really itchy ankles, and then I started to itch elsewhere on my body, so a little bit on my arms, a bit on my legs. And what do you do in pregnancy? You look up your scary symptoms online, and there's always people saying, oh, it could be this and it could be that. So one piece of advice that I read said that itching could be down to liver function issues. So when I went to the midwife, they tested me. I had the liver function test, and that was good because there was no issues. But the itching continued to get worse. And one of the other kind of scary pregnancy things is that quite often you can suffer from insomnia. So there was one night this week, I was lying in bed, and I think just because there are so many things happening with your body, so many hormonal changes, so many unknowns that you're not sure, especially if you're a first time mum, you're not sure about what's about to happen to you. So I was just lying in bed for hours, kind of itching. So the itching was just driving me mad. And the next day, what I did was I called my midwife, and they suggested that I should go to the maternal assessment unit if I am itching in the way that I was. And just to be safe, that was the best course of action. So I went to the maternal assessment unit, and as typical with most pregnancy appointments, they ask you to give a urine sample. And then what they actually did was they asked me about my symptoms. So I told them that I was getting severe itching and it was keeping me up at night. So what they decided to do was they wanted to monitor me fully. And I was actually quite surprised at the approach that they took. So they decided that they wanted to hook me up to something called a cardiotocography machine, so a CTG machine. And what they did was they got me to lie on the bed, and they put these belts around my belly. So I am 37 weeks pregnant now. So I think because I am quite far along, this is a machine that they use to check on the baby and see how it's going along. So I had this absolutely fantastic midwife, and I had a medical student actually with the midwife, but the midwife that I had was excellent, and she was able to explain everything to me. So even though I was quite scared that they were hooking me up to this machine, you know, it's made it seem like, oh, what are they looking for? You know, I've come in a little bit worried about itching and they've hooked me up to this kind of very medical, scary machine. But she really kept me calm and explained to me the whole way through exactly what was going on. So the CTG machine had 2 sensors that they placed on my belly. One was on the heartbeat of the baby. So they found which position she was in and they placed that there. So the machine was measuring the heartbeat of the baby to see if it was under any stress or anything like that. And then the other monitor was actually there to measure any contractions. So it was all hooked up to this machine, and when you're on the CTG machine, you have to be on the machine for half an hour. So you're hooked up to this machine for 30 minutes, and the midwife said, please do not move too much, because if there's any gap in the monitoring while they're doing the machine, then you have to do it for another 30 minutes. So I was really making sure that I wasn't moving and sitting there really calmly. So the machine monitored the baby's heartbeat, and actually it was quite interesting to see that when the baby started moving, you saw the increase in the heartbeat, the corresponding increase in the heartbeat. And the midwife was explaining, it's just like any person, you know, as soon as you start moving around or kind of running around, then your heart rate goes up. So, you know, that happens with the baby as well. And the data that the machine pulls together is really interesting, and it records it like a wave. So what it does is it measures the baby's heartbeat continuously for half an hour, like a wave, and it also measured for any contractions. And I hadn't thought that I'd had any Braxton Hicks or anything like that during this pregnancy, but actually being hooked up to the machine, she was able to show me a jump in the wave of the contraction measuring part, and we were able to, and the reason why they measure the contractions alongside the baby's heartbeat, because what they want to see is that when a contraction happens, that the baby's heart rate does not respond, and that the baby is not scared of the contraction. So that's good, because it means that the baby's not in any distress. So that really helped to put my mind at ease. So while I was hooked up to the machine, I also had to have all of my blood work taken. So the reason that I went in was because of the severe itchiness, and the midwife did say that quite often severe itchiness can just be around stretch marks and all the hormones making you itchy, but they really want to be better safe than sorry. So they took my blood to perform the liver function test again, and I think the other thing was just checking for preeclampsia, because my swelling is quite bad. They also took my blood pressure, which this time was a little bit high. So I said to them, oh, normally if I relax, then if you take the blood pressure again, it normally goes down. So I tried to relax, but the CTG machine had one of those kind of like hospital beeps, like beep, beep. So it was quite scary, shall we say, being kind of strapped in the bed with being monitored, and then having you've had blood taken, and then you've had your heart rate taken. So actually when they did it a second time, it got even worse. So then the midwife said to me, look, we need to now take your blood to check the platelets because your blood pressure's got worse. But I really do think it was just, the whole point was that I was sitting there and I was kind of hooked up to this machine, and I was kind of lying on my back. I had a little pillow, but one of those other things about, you get a lot of backache in pregnancy, and it was just so uncomfortable being hooked up to everything, that obviously it was just kind of stressing me out, making my blood pressure go high. So after the results came through, the midwife was excellent. She talked me through all of the results and she said everything looked fine. They asked me to come in tomorrow to give them a call to find out the results of the blood work. And luckily I called them this morning and everything turned out fine. But I just wanted to reiterate that it could have not been fine. So if you do have any scary pregnancy symptoms, then I suggest that you do contact your healthcare provider with any concerns that you have. When you sneezed, I tried to stop, so we might